Hi guys, welcome back to the channel. So we have dealt with what is BLS, and in BLS we'll mainly focus on CPR and AD, and then we have dealt with what is cardiac arrest, because when there will be cardiac arrest we will give CPR, and then afterwards we will dealing with three main things in BLS, that is breathing, circulation and airway. Okay, let's start today's class. Cardiac arrest. No blood or tissue oxygenation. Brain sustained damage for 4 minutes. After 4 minutes, irreversible damage occurs. After 1 to 2 hours, cells of body die. Then CPR come in role. It come in role in the between time we have dealt in first class. Causes blood to circulate to brain and heart. Enough blood to brain, delaying brain death, and allows heart to remain responsive till defibrillation. This is the flow chart. I am telling you what happens when cardiac arrest is done and what happens when CPR is done. Okay. Now, one more flow chart we'll see today in today's class. BLS healthcare provider. They verify scene safety. Then victim is unresponsive, shout for nearby help, activate emergency response system, get AED and emergency equipment. Okay. Now look for no breathing or only gasping and check pulse. If it is normal breathing and has pulse, monitor until emergency responders arrive. Okay, if there is no normal breathing but still having pulse, then provide rescue breathing, that is one breathe every 5 to 6 seconds or 10 to 12 breaths per minute. One breathe every 5 to 6 seconds or 10 to 12 breaths per minute. If there is no normal breathing, if there is normal breathing with pulse, then monitor until emergency response arrive. Okay. Now if there is no normal breathing but still have pulse, then give rescue breaths. Then activate ERS after 2 minutes. Continue rescue breathing. Check pulse after about every 2 minutes. If possible, opioid overdose, administer naloxone if available per protocol. This step you can avoid, but if possible we can give that. So it creates a response, so patient respond. Now, if there is no normal breathing, only gasping and no pulse is there, then we will go for CPR. Then CPR come into play. When there is no normal breathing, only gasping and no pulse is there, then CPR. Begin cycles of 30 compression and 2 breath. Use AED as soon as it is available. 30 compression, 2 breath. 30 compression, 2 breath. Okay, till AED arrives. When AED arrives, check the rhythm. Yes, shockable. Give 1 shock. Resume CPR immediately about 2 minutes. Continue with ALS provider take over or victim starts to move. ठीक है, ये तब तक कंटिन्यू करना, या तो ALS प्रोवाइडर आ जाए, नहीं तो विक्टिम मूव करना स्टार्ट कर दे. देन इफ़ नो नॉन शॉकेबल, resume CPR immediately for about 2 minutes and same continue until ALS provider take over or victim starts to move. 2 things is there. अगर शॉकेबल है, चेक रिदम कर रहा है, यस रिदम इज देयर एंड शॉकेबल, देन शॉक देना, एक शॉक, उसके बाद फिर CPR. इफ़ इट इज़ नॉन शॉकेबल, डोंट गिव शॉक, देन वी विल जस्ट रिज्यूम द CPR. दिस इज टेलिंग कि जब हम लोग को ऐसा कोई पेशेंट मिले कार्डियक अरेस्ट का एंड वी आर सीइंग दैट विक्टिम इज अनरिस्पॉन्सिव, देन we have to check for pulse and breathing. If normal breathing and has pulse, then we will monitor. Then if no normal breathing but has pulse, we'll provide rescue breathing. And if there is no pulse, no breathing, only gasping, we'll go for CPR and then wait for the AED to arrive and give defibrillation. Okay, this is all for today's class. We'll continue in next class. Till then, like, share, subscribe. Bye.